Good morning to one and all. This is in continuation with our e-content lecture series from Department of General Pathology. I am Dr. Vishwaja. The topic of discussion in today's e-content lecture series is fatty liver. As we are all aware of, fatty liver is one of the reversible degenerative cell injuries. Now, this condition occurs in individuals where there is accumulation of fat due to derangement in the fat cell metabolism. The fatty change may be classified into mild and reversible changes, and if this fatty liver were to progress, then it gets converted into an irreversible cell injury and finally cell death occurs. Now, coming to the definition of fatty liver. Fatty liver, or it is popularly also referred to as fatty change, steatosis, where there is accumulation of intracellular neutral fat inside the liver cell parenchymal cells. Fatty change is commonly a condition which is seen in the liver cells. The same fatty deposition can also occur in certain other vital organs, namely heart, skeletal muscles, kidneys, and etc. Now, coming to the major causes or etiological factors postulated in the onset of fatty change occurring in the liver. To start with, conditions where there is excessive fat deposition, namely obesity, diabetes mellitus, alcoholic liver diseases, starvation, protein calorie malnutrition, chronic illnesses such as tuberculosis, late pregnancies, hypoxia, example in conditions such as anemia and hypoxia leading to congestive cardiac failure, presence of hepatotoxins, examples carbon tetrachloride, chloroform, aflatoxins, ether, and various other poisons. All this can lead to the onset of liver cell damage. There are also certain drugs which induce liver cell injury. Examples, methotrexate, steroids, carbon tetrachloride, halothane, anesthetic agents, tetracycline, etc. Paracetamol also can lead to drug-induced liver cell injury. Certain other syndromes also are associated with the onset of fatty liver, namely Ray's syndrome. Next, we will discuss the pathogenesis leading to the onset of fatty liver. Generally, any lipid is derived from two important sources which is present as free fatty acids. Number one, from the diet, which is available as chylomicrons, which contain very high triglycerides and phospholipids. And number two, from adipose tissue, where they are readily available as free fatty acids. Now, apart from this, during the onset of fatty liver, the triglycerides start getting accumulated inside the cells and leading to the defect in one of the 6 major steps which are involved in the normal fat metabolism. To start with, number one, there is increase in the entry of free fatty acids into the liver. This is followed by increased synthesis of fatty acids by the liver. This is followed by decreased conversion of fatty acids into ketone bodies, thereby resulting in esterification of fatty acids to triglycerides. Number 4, there is increased alpha glycerophosphate production, causing increased esterification of the fatty acids again into triglycerides. Number 5, decreased synthesis of lipid acceptor proteins, thereby resulting in decreased formation of lipoprotein from triglycerides. And finally, there is a block in the excretion of lipoprotein from the liver into the plasma. So coming to the causes of fatty liver. So any patient who is a chronic alcoholic, the liver cell injury is multifactorial and is discussed as follows. So there could be an increased lipolysis, or there could be an increased free fatty acid synthesis, or it could be due to decreased triglyceride utilization, or it could be due to decreased fatty acid oxidation into the ketone bodies, or due to a block in the lipoprotein excretion. So all these factors are attributed in the formation of the liver cell injury. Now coming to the gross morphological features of fatty liver, to start with, the liver which is injured is enlarged. It has a glistening capsule with rounded margins. The cut section of the liver shows bulges and it appears pale yellow in color, and it has a greasy or fat-like consistency. Now coming to the microscopic features of fatty liver, generally in a patient with a fatty liver, the biopsy shows presence of numerous fat or lipid vacuoles which are seen present in the cytoplasm of the hepatocytes. Now these fat vacuoles or the fat content is not visible to the naked eye. So hence we require certain special stains to demonstrate the presence of the fat content. Now in a H&E section, the presence of vacuoles initially may appear as small fat vacuoles with presence of a centrally placed nucleus when it is referred to as microvesicular, or they may be major fat vacuoles which could be pushed to the periphery, and the nucleus when it is pushed to the periphery. In such a condition, the fat vacuoles are referred to as macrovesicular. However, the hepatocytes which are laden with large amounts of lipid vacuoles can tend to rupture, and the lipid vacuoles can coalesce finally to form the fat cyst. Now these fat cysts on a histopathological section demonstrates or they appear as numerous collection of lymphocytes, macrophages, and also presence of multinucleated giant cells, and they coalesce together to form the formation of a lipogranuloma. Now, the special stains used in the demonstration of fat are as follows. The fat stains include Sudan dyes, which include Sudan 3, Sudan 4, Sudan black, oil redo, or alternatively osmic acid also could be used as a fixative as well as a stain to demonstrate the presence of fat which is present inside the fat tissue, that is inside the liver parenchymatous cells. With this, we conclude today's session of e-content series. Thank you.